السلام عليكم ورحمة الله وبركاته. Last four cranial nerve. Number 9 glossopharyngeal. Cranial nerve number 10 vagus. 11 accessory. And finally number 12 hypoglossal. First of all, you have to mention 1973. You have to put in your mind before these nerves contain parasympathetic. One يعني vagus اللي هو number 10. So here number 10 contain parasympathetic fiber. And number 9 also here glossopharyngeal. So two nerves from the last four cranial nerve contain parasympathetic fiber اللي هو glossopharyngeal and vagus. So we start first by glossopharyngeal nerve. Glossopharyngeal nerve from its name. Glosso means tongue, so it supplies the tongue. And pharyngeal supply the pharynx. يبقى from the name you can detect the supply or distribution of the nerve. Glosso يعني tongue and pharyngeal pharynx. طيب this nerve is mixed يعني contain motor nucleus, sensory and parasympathetic nucleus. The sensory nucleus we took it before in nerve number 7 facial اللي هو nucleus solitarius. So the nucleus for the sensory solitarius. And the motor, we will mention this nuclei in nerve number 9 and 10 and 11, which is motor nucleus for all these three nerves, named nucleus ambiguous. Any motor supply for these three nerves arises from this nucleus ambiguous. And the parasympathetic, we took it before in GIT in parotid gland, the parasympathetic supply of the parotid gland. So this important parasympathetic for the parotid inferior salivary nucleus. This nerve exit from the post-olivary fissure of the medulla. Post-olivary fissure. After that, exit from the posterior cranial fossa, posterior fossa of the skull, and exit from the skull from the jugular foramen. The cranial nerve number 9 and the number 10 and the number 11 also exit from the skull from the jugular foramen. After that, it descends in the carotid sheath between internal carotid and internal jugular vein, like that. Then wind between internal carotid and the external carotid artery and terminate in the pharynx between the two muscles in the wall of the pharynx, in the gap 2 in the pharynx, between the superior and the middle constrictor muscle of pharynx. This is the termination of the glossopharyngeal. طيب, what about the supply of this nerve? Supply. Here, motor supply only one muscle of the pharynx. What is the name of this muscle? Stylopharyngeus muscle. Stylopharyngeus muscle. طب what about the sensory? This nerve from the name, glosso يعني tongue. يبقى so it give lingual branch to supply general and taste sensation للposterior 1/3 of the tongue. So any lesion of this nerve, loss of the general and the taste from the posterior 1/3 of the tongue. And also pharyngeal, so it is named pharyngeal plexus, share in the formation of what is called the pharyngeal plexus, and share mainly in the sensory part of this plexus, sensory to the wall of the pharynx. And in between the tongue and the pharynx, we have the palatine tonsil, so it gives tonsillar branch. What is the nerve supply of the tonsil is glossopharyngeal, tonsillar branch. And also give carotid sinus branch. You know what it means by carotid sinus reflex? Carotid sinus reflex. Any increase in the blood pressure, we have a carotid reflex. And this reflex formed from afferent and efferent. The afferent will be number 9, glossopharyngeal, and the efferent to decrease the blood pressure will be number 10, vagus. So this reflex formed by 9 and 10. What else? And also parasympathetic. The inferior salivary nucleus will give tympanic branch to the tympanic cavity, in middle ear, which form tympanic plexus. And after that will give lesser superficial petrosal nerve, lesser petrosal nerve. And this lesser petrosal nerve will relay in the ganglia. What is the name of this ganglia? Otic ganglia. So what is the parasympathetic ganglia of the glossopharyngeal will be parasympathetic otic ganglia to supply the parotid gland parasympathetic parotid gland. طيب, what happened to the lesion of this nerve? The lesion number 1 decreases secretion from the parotid, loss of secretion of taste and the general from the posterior 1/3 of the tongue, and the loss of the carotid sinus reflex, and also one of the most important loss of gag reflex. Gag reflex. We have two reflex, carotid reflex and gag reflex. Gag reflex also formed by, what means by gag? يعني touching the back of the tongue by a tongue depressor. This reflex induce vomiting or about to vomit. Loss of this gag reflex يبقى loss of this reflex. What is the formation of the reflex? By glossopharyngeal afferent and by vagus efferent. This is regarding to the glossopharyngeal nerve. Regarding to the nerve number 10. Nerve number 10 is named the vagus nerve. Vagus nerve. Also parasympathetic. So it is motor also. And sensory. And parasympathetic. طبعا السنسوري the same, solitarious. And the motor the same, ambiguous. But the parasympathetic here in the vagal trigone in the dorsal surface of the medulla, it is named the dorsal motor nucleus of vagus. This nerve exits also from the post-olivary fissure of the medulla. And in the posterior fossa, the same of the glossopharyngeal. And also exit from the skull from the jugular foramen. So jugular foramen contain number 9, 10, and 11. After that, it descends in the carotid sheath between internal carotid and internal jugular, and between internal jugular and common carotid, and go and crossing to toward the thorax and enter the thorax. This is the vagus. Fine. What about the supply or the branches of the vagus? The vagus nerve supply number 1, auricular branch, الأوريكل and the external auditory meatus and tympanic membrane. And they supply the meninges of the posterior fossa, so it give posterior meningeal or meningeal branch. What else? Very important to supply, give branch to the pharynx and the 2 branch to the larynx. So the branch to the pharynx, the pharyngeal plexus, it is a motor part of the plexus. Motor part of the plexus. Supply what? All muscle of pharynx, all muscle of the pharynx, except stylopharyngeus, supplied by glossopharyngeus. And all muscle of palate, except any muscle named tensor bimandibular, tensor palati, bimandibular nerve. So very important here, supply the motor for the pharynx and the motor of the palate. All the muscle of the palate except the tensor palati, and all muscle of the pharynx except the stylopharyngeus. So any lesion here will lead to what is called dysphagia, difficult in swallow. So if you wanted to test the nerve, ask the patient to swallow. Number 2, the patient complain if the lesion of the palate regurg of the food from the nose. So here muscle of the palate will lead to regurg of the food from the nose. What else? This nerve supply two important nerve to the larynx. Two important nerve to the larynx. Very important nerve to the larynx. One is named the superior laryngeal nerve, and one is named recurrent laryngeal nerve. Superior laryngeal nerve supply to give two branches. One is internal laryngeal nerve, and one is external laryngeal nerve. طيب supply what these nerves supply all the larynx. يعني the recurrent laryngeal supply all muscle of the larynx except all intrinsic muscle of the larynx except cricothyroid muscle tenses the vocal cord. What is the name of this muscle? Cricothyroid. طيب what supply this muscle supplied by what? By external laryngeal. So external laryngeal supply cricothyroid muscle. Cricothyroid muscle. Internal laryngeal supply the sensory above vocal cord. Above vocal cord. Only sensory. But the recurrent laryngeal also supply sensory below vocal cord. This is regarding to the branches of vagus. Again, يبقى pharyngeal to the muscle of the pharynx and the muscle of the palate. Two laryngeal, one recurrent and one superior. The superior internal and external. The internal only sensory above vocal, but the recurrent sensory below vocal. And external laryngeal supply only one muscle, cricothyroid, and all the remaining muscles supplied by the recurrent. So any lesion here of the vagus, loss of the sensation from the larynx, and also hoarseness في الvoice. Hoarseness في الvoice. And also loss of gag reflex and the carotid sinus reflex. And here it is very important to test this nerve by asking the patient to open the mouth and see to see the uvula. The uvula must be in the midline. So deviation of the uvula to one side means lesion of the opposite side of the vagus. Yani means if there is uvula deviated to the left side, so right vagal lesion. This is regarding to vagus nerve. What about the nerve number 11? Accessory nerve. Accessory nerve. Accessory nerve, alhamdulillah, it is motor only. Only motor. And arise by two routes. Cranial from medulla, from ambiguous, and the spinal from the spinal cord. Upper 6 segment of the spinal cord. So here we have the medulla. This is a pons. This is a medulla. This is a foramen magnum. And this is a spinal cord. The spinal root arises from 5 segments of spinal cord to form spinal root. The cranial from nucleus ambiguous of medulla. This is the cranial root. يبقى cranial from ambiguous. What happened? The spinal ascend through foramen magnum and go inside the skull in the posterior fossa and unite with the cranial and forming a new nerve named accessory nerve or united accessory. This nerve exits from the jugular foramen and descending in the neck in the carotid sheath, and after that it divide again into cranial and spinal. Cranial and spinal. So It is formed by the union of the cranial and the spinal, and after exit from the skull, it separate again into cranial and the spinal. The spinal will supply two important muscle of the neck and back, sternomastoid, which is very important, turning the face to the opposite side, sternomastoid, and the trapezius, very important for elevate shoulder, able to elevate or shrug shoulder, trapezius. So any lesion of the sternomastoid, the patient unable to, to turn the face to the opposite side. But the trapezius lesion, the patient unable to elevate the shoulder, or what means by drop shoulder. طب what happened to the cranial of accessory nerve? The cranial, it will join to the vagus and distribute to the pharyngeal and the laryngeal branches of the vagus. يبقى the cranial go to in the fiber of the vagus, so it means vago accessory, يعني forming a fiber named vago accessory. But the spinal here, it supply only two muscle, sternomastoid and the trapezius. So here, if you wanted to testing the nerve for the patient, ask the patient to turn the face to both sides, opposite side, to detect the sternomastoid, and ask the patient to elevate the shoulder against the resistance to detect the power and the function or the action of the trapezius. Final nerve will be hypoglossal nerve. Hypoglossal nerve. This is cranial nerve number 12. This nerve motor, alhamdulillah, motor, from hypoglossal nucleus in the medulla. This is the origin. And exit from the pre-olivary fissure. And also in the posterior fossa. يبقى the last four cranial nerve in the posterior fossa. But exit from hypoglossal canal, not from the jugular, hypoglossal canal. So this nerve arise هنا and descending from hypoglossal canal, and after that it curve toward to supply the tongue. So it is motor, so it is the main motor of the tongue. Supply all muscle of the tongue. Styloglossus, genioglossus, hyoglossus, and also intrinsic muscle of the tongue, except one muscle. This muscle is named palatoglossus. Palato means palate, so supplied by vagus or pharyngeal plexus. طيب, during its descent and the curve toward the tongue, there is a nerve joined with this nerve named C1 and runs along the hypoglossal. C1 يعني cervical nerve number 1. After that, there is also a nerve C2, cervical nerve 2, and the C3 unite together and forming a branch named descendens cervicalis. يبقى descending يعني descend, cervicalis union of the two cervical 2 and 3. What happened? C1 during the run, it's a run with hypoglossal, it send a branch to join with the descending cervical. What is the name of this branch? It's named descending hypoglossy. Both descending unite together and to supply the infrahyoid muscle. What is the name of this nerve? Ansa cervicalis. Ansa cervicalis. Also C1 during its descent with hypoglossal supply to muscle, thyrohyoid muscle and geniohyoid muscle. So the hypoglossal itself supply all muscle of the tongue. But with the C1 supply thyrohyoid, geniohyoid muscle, and give descending hypoglossy to union or unite with the descending cervical to form ansa cervicalis. This nerve, if you wanted to test this nerve in the patient, ask the patient to draw the tongue outward, will be in the midline. If deviation of the tongue will be same side lesion or same side paralysis of hypoglossal. So this is glossopharyngeal mixed nerve, ambiguous, solitarious, descending to supply what? Supply the tongue, very important, the tonsil, the pharynx, the carotid sinus and the carotid artery, and supply only one muscle. Descend in the carotid sheath, and very important to terminate between superior and the middle constrictor of pharynx, and exit from the post-olivary fissure. Gives the parasympathetic branch to tympanic plexus, lesser petrosal, and otic ganglia. So otic ganglia, very characteristic to glossopharyngeal nerve. And the supply only one muscle, stylopharyngeus, and the supply carotid sinus reflex, carotid sinus nerve, and the pharyngeal sensory part of the pharyngeal plexus, and the tonsillar to the palatine tonsil, and the soft palate, and the lingual supply the general and the taste to the posterior one-third of the tongue. Ask the patient to swallow عشان الافرنت sensation of the pharynx, and also touching the back, loss of the gag reflex, and also carotid sinus reflex, and loss of the taste من الposterior one-third of the tongue. Vagus nerve the same, but here ambiguous the same, solitary the same, but here there is a mistake in هنا, it is not inferior salivary, will be dorsal motor nucleus of vagus. Dorsal motor nucleus of vagus. And the supply solitarius, the sensory nucleus. Also descend in the posterior fossa in the carotid sheath between the internal carotid and the internal jugular, internal carotid and the common carotid, and enter the thorax. Supply the meningeal of the posterior fossa, auricular للأوريكل والميتس والtympanic membrane. Pharyngeal, very important to supply all the muscle of the pharynx and all the muscle of the palate. All the muscle of the pharynx except the stylopharyngeus, all muscle of the palate except tensor tympani, tensor palati, and also give to laryngeal. Superior laryngeal will give external and internal, external cricothyroid and internal supply the sensation above vocal cord. Here the recurrent left recurrent بيعمل curving below the arch of the aorta, but the right recurrent بيعمل hook below the subclavian artery. Supply water recurrent all muscle of the larynx except the cricothyroid and the sensation below vocal cord. هنا ask the patient to see open and see to see the uvula must be in the midline. Deviation to the left side as we see here means right vagal damage. Accessory, cranial and spinal unite together and separate after exit from the jugular foramen and supply to muscle spinal اللي هو الستernocleidomastoid and the trapezius, which is very important for turning the face to the opposite side and elevate the shoulder. But the cranial will be in the fiber of vagus. As we see here, this is a drop shoulder and also inability to turn the face or the head to the opposite side. Hypoglossal supply the all muscle of the tongue. يبقى موتور هايبوجلوسال نيوكلاس بري اوليفر في البوستيريور فوسا and hypoglossal canal join مع C1 and supply all muscle except البلاتوجلوسال باي فيجاس and مع C1 اللي هو انزا cervicalis through descendens hypoglossy and supply thyrohyoid and geniohyoid. Ask the patient to draw the tongue outside. Deviation to the left side, as we see here, mean left side hypoglossal lesion or left hypoglossal paralysis or injury. Here, patient admitted to the hospital عنده tonsillitis. Tonsillitis, what is the nerve supplies the tonsil? أكيد glossopharyngeal nerve. Here, the uvula is deviated to the left, so the right vagus lesion. Here, a base of the skull في trauma في البيز of the skull, which foramen the vagus passing through jugular. This is the foramen magnum. This is the hypoglossal canal. This condyle, this is jugular. Number E jugular foramen. هنا دروب شولدر يبقى accessory. And هنا hypoglossal will be right hypoglossal lesion same side.